And it ends up being a complete reset for the mind, body, and spirit. And oftentimes insomnia actually is a cure during that time. And I just wanted to mention that.
I am delighted to introduce you to Dr. Judith Pentz. I'm going to let her explain her background, but today we're talking about Ayurvedic rituals for better sleep. And it's extra special for me because I used to work in a psychiatric clinic, and the director of that clinic used to tell me all these wonderful things about an integrative psychiatrist who worked there by the name of Judith Pentz. And then we ended up connecting at a conference, and we've collaborated a few times since then. Dr. Pentz, I'm so delighted to have you here. As we get started, can you share a bit about your background and what you do?
Sure. So thank you so much, Nishi, for inviting me. I've enjoyed the collaboration we've had over time. And so I'm actually a child, adolescent, and adult psychiatrist. I still see people of all ages, as young as 5, as old as 90, and once. Usually I try to limit it to 75 at this point. I currently am working at the University of New Mexico, where I teach an integrative course for residents and child fellows focused on integrative medicine. And it is the gamut. It's not just specific to Ayurveda. So that's a recent development here in the last, since 2018, I've been doing that, and I've really enjoyed being able to support. It is an elective, but each year I have anywhere from 4 to 8 people from each class, usually the third years that are interested in learning about this, and then some of the fourth years, and then, of course, the child fellows, depending on what year they're in. So that, and then I also have a private practice where I've worked with people of different ages. And more recently, I've focused on health and wellness with individuals. In the past, I've done a fair amount of weaning people off their medications, but have found that many contributing factors are needed in that instance. And so have backed away from doing that very often at this point and do it very selectively. In addition, I've written a book about my experience with panchakarma. It's a prescriptive memoir. And it was when I took a trip to India where I was able to learn a little bit more deeply about the process. That actually happened maybe 10, 11 years ago. And I've kept up the process with the panchakarma pretty regularly since then, because it is an incredible detox that happens for the body and the mind. And surprisingly for me, and that's why I wrote the book, it's amazing how it impacted my spiritual and my mental life in terms of my emotions and stuff. So I really had wanted to share the process, and that's why I wrote about the book. In the meantime, I've done many things too in terms of learning more about Ayurveda, and have helped to teach allopathic medicine at the Maharishi University. I recently stepped down from that role, but I helped a few cohorts of the master levels class there. So I learned a lot of Ayurveda while I was teaching all the allopathic medicine.
You have a really unique perspective with the allopathic background, being a conventionally trained psychiatrist, and having the integrative and the Ayurveda piece. We just talked about a few different things, panchakarma, Ayurveda. For anyone who's not familiar with those terms, can you explain briefly what Ayurveda is? And for the clinician who's listening, who's thinking, that's not evidence-based, right? Like, where is the data for any of that? Could you share a little bit about how to think about Ayurveda? And then we'll go into some of the rituals and practices for better sleep.
Ayurveda is Sanskrit for the science of life. And it is at least 5,000 years in terms of practice in India. And it's probably older than that, but that's when they started writing things down. And it is a medicine that the foundation has to do with supporting one's well-being and prevention. And that is the journey that I have found really fascinating, and is the part that I write about in my book, but also bring into my practice. It is science-based. It's clinically science-based. It isn't necessarily at the gold standard that we're familiar with in terms of taking one piece of information and drilling down and proving that point. But there have been studies done, and I just wanted to mention a few. It's been shown, especially following the self-care rituals that we'll be talking about, and the different things along that line. It has helped to show that it helps with quality of life, and that the adherence to the protocol is much higher than the typical protocols that might be out there for self-care. It has been shown to really address stress and burnout. And it's been very good at supporting healthier choices and healthier behaviors, and improving psychosocial well-being, as well as the importance of routine. And that's really, again, part of what I've been trying to promote here in the last few years, that self-care matters and it has to happen daily. And that's the beauty of what Ayurveda offers in terms of some of the information we'll talk about today.
I think that's such a beautiful description of what it is. And one way to think about Ayurveda, how I might explain it to clinicians who aren't familiar is that it's the original lifestyle medicine. And yeah, and it's full of practices that are essentially rooted in common sense, many of them. And Ayurveda has a really lovely way of honoring the rhythms of nature and the rhythms of daily cycles. And what I find so fascinating about it is that its understanding of the circadian rhythm is really sophisticated and it's aligned with our modern understanding of the circadian rhythm. So that might be a good segue into talking about the Ayurvedic view of the body clock and how is that important or helpful for sleep?
Yes, I wanted to mention because there's going to be a couple terms that I'll be using, and I thought it might be good to talk about. It's not necessarily a definition, but a better understanding of where some of the and this knowledge that Ayurveda has. First of all, I just wanted to mention, and this is probably common knowledge, but before we had electricity, we were actually connected with rhythm of the world, rhythm of the day, rhythm of the seasons, right? But with electricity and all the electronics that we have, and having light on all the time at various points in our life, we aren't as tuned in to nature as we once were. And it's had a huge toll on us. And it's not just here in this country. This is a worldwide problem that we're talking about. And I know that the World Health Organization has tried to address that, whether it's being light pollution or noise pollution, air pollution, all those basics that we've taken for granted that we're really at risk now in terms of losing for a lot of reasons. I wanted to mention, like you were saying about Ayurveda, it is, in terms of the circadian rhythm, it's so important. And also the other thing is your age that you are is so important. Location where you live is so important. And so it's really understanding that there's these concepts of the elements that we live with. We're talking about the basics: ether, air, fire, water, and earth. And knowing these elements, they come together and they create our world around us. And it's a very unique perspective in that when you think about the natural world has all these elements, but so does our body, our brain, as well as our mind. And it's so important to understand that because there's a level of a personalized medicine that's possible with Ayurveda that is unique. And I wanted to mention a little bit about the research piece. There is more and more research supporting, especially the self-care tools, that they are very helpful. Small example would be like scraping the tongue. Now, many practitioners, including dentists, are mentioning this is a good habit because it helps to detox the body a little bit and is a reset point for the body, but also improves digestion and improves saliva in the mouth. And so back to there's three constitutions or three combinations of these elements that come together. Vata, which is ether and air. Think about a cold, windy day, and those are the qualities that Vata carries. Pitta is fire and a little bit of water, and think of a hot and humid day. And then the third quality is that of Kapha, which is earth and water, which is heavy and moist. So you think about a foggy morning, and those are characteristics. So each of us carry a higher level of those qualities in each of our beings. Like for me, I'm Pitta Kapha. So there's that fire and some water and some earth with some water. But I'm also over the age of 50. And so I also have to deal with the energy of being in a Vata stage of life. So all those elements come together to impact how we manage our day or don't manage our day. And I just wanted to mention that because I thought it was important to understand just that little bit there.
It's helpful and interesting to understand your own constitution and how that can inform the various practices to engage in. Or if you're a healthcare practitioner and you're working with a client or patient, understanding how some of these different dynamics might be at play can help you come up with a more personalized treatment plan for them. One of the questions I get a lot from patients that I work with or other practitioners is, how do I know what my dosha is? You said you're Pitta Kapha. I'm more of a Vata Pitta type. So how would you find out? Are there any good quizzes or resources you recommend?
Yeah, there are. I would say anybody who has a focus on Ayurveda has it available on their website. I do, and that's drpentz.com. But also, there's actually a company in town here in Albuquerque that sells Ayurvedic products, organic and well sourced, and also tested for heavy metals, which is a concern I know for many people about Ayurvedic herbs. I'll mention them by Banyan Botanicals. And they also have a nice quiz and some teaching of some of the tools that I'll be mentioning here today that can give a perspective for people in terms of their self-care needs.
That's really helpful. And I'm glad you mentioned that. Banyan Botanicals is one of the brands that I recommend as well for herbs. I have no affiliation with them, but like you said, they're good quality products. Okay, so let's talk about some of the rituals from Ayurveda that can be helpful for sleep. Maybe we can start with the morning. How would you approach a morning ritual from an Ayurvedic standpoint?
So again, this is important in terms of knowing your constitution. Okay. For example, I'm Pitta Kapha with some Vata now. And I know that I do well with getting up earlier, especially because of the Kapha piece in my constitution. And we didn't talk about the times of the day, so maybe we could just briefly mention that. The day is divided from an Ayurvedic perspective. Okay. We'll start with Vata, which is 2 p.m. to 6 p.m. and 2 a.m. to 6 a.m. Okay. And this is a very active time for the body and mind if one thinks about what we typically do in the afternoon and much work is done, right? But at night, it also is a very active time for us, metabolically speaking. And there's a cleansing and a restoring, as well as a rejuvenation process that happens both in the body and in the brain. And it's really, if one hasn't noticed, that if you wake up during that time, it's really hard to get back to sleep because Vata is busy doing its thing and the mind is supposed to be resting, but sometimes we rise up for a variety of reasons. And then I wanted to mention about Pitta, that's 10 a.m. to 2 p.m. and then 10 p.m. to 2 a.m. This coincides actually in midday, the heat of the day, and often is even more active for the body and brain to get things done and very motivated. That's Pitta as the mover of most organizations. And it's best also to have our largest meal during that day because it's when our digestive fire is the highest. The strength is our highest, so working out maybe is a good time to consider. And the volume of food is the easiest for you to digest during that time. And then at night, there's also the cleansing and rejuvenating that I mentioned, but it's going to be focused a little bit different. We're not going to go into that today, but different body parts in our body are more Pitta as opposed to Vata. And then it's really important here because, as I mentioned, Pitta is a 10 p.m. to 2 a.m. time frame there. It's when the body actually starts going into the deeper phases of sleep. And there's the lymphatics of the brain that help get rid of brain dirt. And it's been shown that you need anywhere from 3 to 6 cycles, 5 to 6 being ideal, to allow for that full cleansing to happen. And then last but not least, we have the kapha at 6 a.m. to 10 a.m. and 6 p.m. to 10 p.m. And that is much more of a heavier time. You think about a foggy morning, like I mentioned. And so that energy is also present and is a person can actually feel a little bit lethargic if they sleep too much into the morning. So I'm often telling teenagers who want to sleep till 10 in the morning, not such a good idea. This is really important because if you've had a good night's sleep, you can get up earlier and help set the tone for the day and into the night because it's been shown from an Ayurvedic perspective, but also research-based here, walking in the morning sun allows for a reset point in terms of circadian rhythm and also improves mood and reduces depression. So I wanted to mention that because it's a really important thing. And then in the evening time, it's also a time when we're slowing down, our digestion is slowing down, and it's really better to have a lower quantity meal. Digestion can happen, and that needs to be about 2 or 3 hours before bedtime so that there isn't that competition between digestion and getting to sleep. So I thought that would be important to mention again in terms of just the timing of everything.
That's incredibly helpful. And it's so interesting because it is aligned with our modern understanding of the circadian rhythm and sleep science. Like you said, in that Vata time of night, that 2 a.m. to 6 a.m., if you wake up, it's a lot harder to fall asleep at that time. And we know in modern sleep science that sleep pressure is lower in that time of the night. So that's one of the contributing factors to difficulty falling back asleep. There's other factors at play, but that's one big one. And you also mentioned that in the Pitta time, so that 10 p.m. to 2 a.m., that's considered rejuvenating in Ayurveda and in modern sleep science. We know that's when you get more slow wave deep sleep, which is that rejuvenating restorative phase of sleep. So fascinating to see the parallels. Okay, and I also loved how you mentioned the morning light that is during the kapha time, getting that bright sunlight. Again, aligned with our modern circadian understanding and the modern recommendations that many of us are giving to our patients. So what else would you like to share in terms of daily routines to support sleep?
As you can see, there's a lot to learn when it comes to clinical sleep medicine, and we're just scratching the surface in today's interview. If you are a physician or a health practitioner who wants to learn more about clinical sleep medicine in a practical way that you can use in your everyday clinical work, then get my free sleep mini course. I'll put the link to that in the video description below. You can also get it at intrabalance.com/doctors.
So probably one thing I'd like to mention is, and this is when I see many people that anxiety is a primary problem for them. And what I share with them is that it's really good to see what the roots of the anxiety is during the day. And that's before I even knew about Ayurveda, but especially since I know Ayurveda, if we help contain and find ways to be calmer from the get-go in the morning and carry that energy into the day and manage it so that you aren't revved up going into the evening at the same threshold, then winding down is a lot easier. I still see people who want to run a full on in their day and then think that they can just drop off to sleep very easily. But we have now the compounding impacts of electronics, the blue light, the excess stimulation, the gaming that goes on in terms of the war games online. All that is really very stimulating and, dare I say, toxic to the brain, especially into the evening time. And for you to think that you can just shut things off and go to sleep while you maybe are caffeinated in the process is really not honoring your body or your brain in terms of what their needs are.
That's such a great point. And I call that being in the go-go club, that you're go all day long. And then we want our brain to just shut off and our body to go to sleep. And it doesn't work that way. It's not like flipping a switch. Are there any practices that you recommend for people who do have that daytime anxiety? What are some of your go-tos?
So one of the things I talk about too is our body responds to nature because we have our own chronobiology that wants to be in sync with Earth's rhythms. And so finding ways to be in nature when it's reality-based, I understand there can be times when that's a problem, but also having them step back. And this is actually also thinking about for practitioners, do find out what all the sources of caffeine are for people these days. There are so many that it's almost countless at this point. And then since we're also speaking to clinicians, is doing your basics in terms of routine labs, looking for any imbalances. Too often I find people with anemia that haven't been screened in a while or a thyroid condition. I have one person who had Hashimoto for the longest time and nobody had picked it up. And I managed to do it just with a routine screen and she'd been suffering for about 6 months. It's important for clinicians to do the basics. And from there, then you know what you can or cannot do. But for that person too, that's maybe listening, to ask that question, can we get this screened for me today? And then for men and women of a certain age, getting their hormones checked can be really important, especially in light of some of the deficiencies that can happen as we get older.
How do Ayurvedic routines change with age? So, for example, would you modify a daily routine for somebody who's, let's say, a woman in her 30s versus a woman in her 60s? How might that look different?
The first thing to know is from an Ayurvedic perspective, most individuals actually struggle with a vata imbalance. It's too much stress, too much wind, too much of everything present in their life. And so it would really be important to understand doing some self-care routines that help to calm the nervous system down. There probably wouldn't be too much of a change. Probably the main thing I would think about would be the type of oil a person would use. But that's strongly also in terms of the season and one's constitution. But having said that, a woman over 50 is going to be inclined to having drier skin opposed to a woman in her 30s, unless she is vata. If a person is vata, they tend to be drier just in general, including their skin. The recommendations would really be modified depending on their current lifestyle factors, who they are, where they live, for example, because I live in a high desert, high altitude, and I'm in a Vata life stage. So I've got triple factors there impacting me all the time. And so oiling me, even with my Pitta Kapha, it's still an ongoing thing where I haven't mentioned that yet, but I'd like to address that if that's okay at this point. Yes?
Yes, please do.
Okay. So routine in terms of the morning process, often it's getting up and taking care of one's normal evacuation needs. It's ideal to do so immediately, drinking some warm water upon arising too, as well as doing the tongue cleansing that I mentioned. The tongue scraping upon arising actually helps to stimulate digestion, but also can stimulate the taste buds. And so if one is inclined not to have much of an appetite, it can help support that too. But it actually helps with gum recession and the quality of the type of bacteria in one's mouth. So simple routine that's really helpful. The other thing is evacuating the bowels is really important. And then also if a person's inclined, having some sort of meditation routine during this time or contemplation or prayer. And some breath work also, because that helps to stimulate the mind and the body. But also if one does a simple routine of alternate nostril breathing, you're actually balancing the left-right brain, left-right parts of the body, and you actually have an opportunity. And it can be 5 to 10 minutes. It can be mindfulness. It can be a simple word like the word love or grace or something, just focusing on that and allowing yourself to enter the day not full on in terms of the anxiety mode that we've talked about. And then if one has the time, doing some yoga or Tai Chi or Qigong, because these are mind-body exercises that further integrate the body and the brain, but also helps with the waking and the grounding that we need so that we walk more present into our day. Oiling the body before a shower is really key in terms of calming the nervous system down, but it also nourishes the skin, which is one of our largest organs in our body. And if one has time to do the scalp and the face, that's really helpful. Again, setting the tone to be calmer to walk into the day. The other thing is it can be hard to do that in the beginning. So I often recommend people do it on the weekends, at least once or twice, so they can feel the benefits of the whole thing and then maybe work it into their schedule a couple times during the week. I wanted to mention if somebody has insomnia, that you can actually do this in the evening, and it's very helpful in calming the nervous system down, quieting the mind, and allowing for improved sleep initiation, but also the ability to stay asleep through the night. And then one more thing there, coconut oil is best in the summer because it's a lighter oil, and then sesame oil is best in the fall, winter, and into the spring. But again, it depends on where you live, what qualities of the dosha of your Pitta Vata Kapha challenges you may have, and also where your time of life.
I appreciate your mention of the alternate nostril breathing. So I actually had a patient a number of years ago who had severe insomnia and OCD. And so I had her do a 5-minute alternate nostril breathing practice every morning. And it was incredible. Like, she was quite skeptical at the beginning, but open to trying it. Okay, yeah, I'll try it and let's see how it goes. And then she was diligent about it. She did it. She was a good student, did it every single morning, 5 minutes. She came back a few weeks later and said, oh my gosh, this is the thing I look forward to doing every morning because I find it so calming. So these are simple practices that are available to everybody. They're free, they don't have side effects, and we can help patients start slowly. And you just mentioned a lot of different options. For the person who's listening, or if you're a practitioner, just a little tip is offer patients a variety of different things to try and see which ones they want to start with. They don't have to do everything. And Judith, how would you counsel someone on that? They go, oh my God, now I have to do meditation and breathing and drink warm water and do tongue scraping and all this to get my morning sunlight. How would you counsel them on not getting overwhelmed?
You bring up a point that I was doing long before I knew about Ayurveda, and that is meeting the person where they are and really listening to what they are interested in and motivated in doing, and having them pick and choose one of the many things that I just mentioned, because it's really, for them, it's a big change. You know, what I'm talking about, I do most everything I just mentioned, but I've been doing it now for a number of years, and I didn't start with all of it. I added it, and a habit, as you can take up to 30 to 60 days to be instilled. And so what I suggest is that somebody commit to a practice like you did mention with the breath work, and just do it for a while. And then we connect to see how things are moving along. And then when they feel a little bit calmer about it, then they can feel more ready to maybe add a second piece to that. But also doing it on the weekends when you have a little bit more time so that it's not a rushed affair and you have more awareness of the benefit as opposed to just going through it rotely. The process of the oiling of the body and the massage, it's actually a very particular process. And we haven't talked about how, about prana or how there's different qualities of prana, but just the way we stroke our body is actually enhancing how energy flows in our body. And when we come from a place of intention and do it lovingly, two things happen. You're actually offering yourself self-love, but the nervous system is saying, oh, something nice is really happening here and it feels really good. So it's really, and it's been shown that anybody knows, unless we haven't talked about this, and it might be good to mention, unless somebody has trauma issues. I talked with a person yesterday and she has a new puppy, and just the way the puppy is jumping on her is triggering her right now. Now, and it's different when you're stroking yourself in terms of the oil, but I also know that touch may have a negative connotation for people. And so it has to be approached in a way that works for them. And most of the stuff that we're talking about, including sleep issues, if trauma is present, obviously that is a factor that needs to be addressed, and beyond medication with therapy and working through things. And then the ability to sleep is improved.
That's a really important point, understanding trauma, anxiety, and how that might be impacting patients. And tying that again back to sleep, many of our patients struggling with insomnia are doing practices with sleep effort, with the expectation or the attachment to the outcome that is going to make them fall asleep. And so this, again, a little clinical pearl for practitioners, like Dr. Pentz said, meet the patient where they're at, take into account any trauma that might be at play, that might be actually creating more anxiety for them, but also helping patients understand that when you do these practices, it's not to make you fall asleep. These are things that set the stage to invite sleep in when your body is ready for it. But we're not doing the self-massage or the oil practice at night to make you fall asleep. It's more to invite in relaxation, and then sleep may come, it may not come, and whatever happens is okay.
So that's actually well put. It is releasing expectation can be hard if one has struggled. But I often tell people if they are in bed too long and they're not going to sleep, that sometimes getting up and doing something different in a quiet way is the best thing to do, and then come into bed again with less expectation to the best of their ability. So that's beautiful what you just.
So what is the role of nutrition, supplements, and then I want to talk about evening routine as well, but how might you incorporate some of the Ayurvedic herbs like ashwagandha or other ones that people may have heard of, or dietary practices? And I know that's something that you incorporate in your clinical work. So could you speak to that?
Sure. So again, it starts in the morning to help with the day. Routine can be really helpful because of many things. It helps with digestion, been shown to help reduce some inflammation in the body too. And then using an herbal combination called CCF, the cumin, fennel, and coriander. All right. So that combination in small quantities in the ginger tea further supports the calming of the digestion and calming of the nervous system. So sipping on that during the day instead of an energy drink could be a consideration. So that's really helpful. Having certain foods. So we haven't talked about this, but depending on what your constitutional type is, the Pitta Vata dosha combination, the kapha, certain foods are better for you and certain foods aren't, especially later in the day. And so understanding what foods are supportive for you can be really beneficial. And there are actually checklists that one can do based on our constitution that helps you to understand. Once you know what your baseline constitution is, that gives you that information. Additionally, have the option to see an Ayurvedic practitioner at some point. That can be really helpful. And often they can actually start the conversation online, and then eventually, hopefully, you could see someone in person. Because of that, then you can get a much more specific focus on how things are going for you, and that can be of benefit for you. Now, in terms of caffeine, we talked a little bit about that, and as most people are aware who watch this, it takes about 10 hours for caffeine to be fully metabolized in the body. So I do ask people to reduce their caffeine after 2 or 3 in the afternoon. Noon is ideal, but I know that sometimes people want for a little extra support right at the end there, at the end of the workday, I should say. So that, and then also the 4 o'clock time can be a good time to have a nice snack so that you don't necessarily eat as much into the evening. And this is a good time to further offer nutrition for the brain. We haven't talked about all that yet, but it's an important piece. And this is an instance for having a fig, which are here, they're in season right now, fresh fig or a dried fig with some sesame seeds or some good quality nuts is a nice combination to help stay any drop in the blood sugar before the evening meal. So I wanted to mention that because I know some people struggle with, they get into the evening, they haven't had a chance to eat, and it can create their own level of anxiety right there. And I know that it's in the dictionary now that people can become hangry and conflict can happen within the family system. So it's a good thing to stave off. Even just a piece of fruit at 4 o'clock is good too.
That's a great tip. And yeah, I see that a lot in patients. My patients who have anxiety is they may have these drops in blood sugar because they're hungry and it shows up as anxiety. And I've done this practice with people like, okay, let's regulate your meal times. That's also a great way to help regulate the circadian rhythm and support sleep. But regulating their meal times, introducing a snack like the one that you mentioned, mid-afternoon or late afternoon, can be really stabilizing. So for the practitioners listening, don't forget about blood sugar regulation when your patients are struggling with anxiety and insomnia. Many of our patients are interested in Ayurvedic herbs like ashwagandha. How do you incorporate those into a routine? And do you have any tips for practitioners about assessment to know if it's appropriate for a patient, especially if they're not trained in Ayurveda?
Ashwagandha is actually an amazing herb, and it's in a category of what we call adaptogens. And if a person has an interest as a practitioner, learning about adaptogens would be a really good activity on their part. David Winston has a very good book, and he does some training online too in terms of discussions around the qualities and the benefits of adaptogens. Rhodiola, for example, is an adaptogen that's equally wonderful, but can be a bit more stimulating than ashwagandha. And it is actually very calming to the nervous system. The role of an adaptogen is good for a person to understand. And basically what happens is the body responds to the herb and modify accordingly to its need, so to speak. Okay. So if a person is too anxious, like the ashwagandha actually helps to calm them down. If there's actually some low energy, it can actually help to pull them up a little bit. And so basically what adaptogens do is they help normalize the body's functioning without interfering necessarily with a lot of with medication, that type of thing. I often have used ashwagandha for a calming response for a person, but as most herbal products, it's pretty rare that you're going to have a response that's really quick. And so in this instance, a person needs to be ready for a 3 to 4 week time span before they notice the full benefits. In that instance, I would actually add some amino acids to the picture. My first go-to actually tends to be theanine, which is a green tea derivative amino acid. It's standardized, accessible to most people. As a child psychiatrist, it's actually my first go-to as opposed to an SSRI for kids. And I loved being able to use it because it's not overly sedating. And there's a small body of information out there and research that it actually helps support the alpha wave production. Okay. And so that helps to calm the nervous system again and is quite, I think maybe a dry mouth at a higher dose, but I had virtually no side effects. There's a small percentage where people aren't benefiting from it. And then I might lean towards some essential oils like lavender, or I might even include the lavender too, because it's a much more immediate effect. There is an oral form of that available now too, Selexin, that's really nice for people. And additionally, I'll talk about teas that are very helpful and calming and having them drink that in addition to maybe the ginger tea. So, and then I bring in magnesium because many of us, the majority of the population, tend to be low in magnesium, and it is so beneficial in calming the nervous system. And again, when we talked earlier about starting ahead of the game and staving off the anxiety, starting with a dose of magnesium, like magnesium citrate or something similar, not so much with the organic. You want the mineral to be tied in with organic acid. And that helps with better absorption and less problems with loose stools, which people know that magnesium can create. So, but simple solutions like that can be really helpful. And the breath work that I mentioned also can be helpful.
Excellent. That's so helpful. So when it comes to an evening routine, what do you recommend?
So one of the things to think about is, as we mentioned, it's the kapha time of day, and it's a quieter, heavier time of day in many respects. So it's really good to look at lifestyle, and I do a sleep hygiene analysis with people to really understand what their especially with kids. I do that too, with their parents, obviously. But I understand what the problems are up to bedtime. So I sort that out. And then there's simple things in terms of the nighttime routine that actually I think we're more and more aware of that now these days. And actually is something called Vastu in Ayurveda. Okay. It's similar to Feng Shui. And they actually have some rules of how energy flows in the house. And one instance is where your headboard should be. Okay. And the headboard should actually be south and never north. Okay? And so that's something for people to think about. And it's interesting for me, I should say. Each time I've moved, I've ended up with my headboard to the south without even thinking about it. And so it's something to help, because it's something to think about, because I would ask a person to experiment with that to see if it has benefits. Okay. Keeping the bathroom door closed if there's a bathroom in the space, okay, including the toilet seat down, because there's energy that's being lost with the water flow that happens in there, okay. Simple thing, but an interesting one. Again, this is Vastu, which is basically looking at the science of architecture and how energy flows in the home, okay. No clutter under the bed, okay. No books near your bed is best, maybe one or two at the most, okay. No pictures of deceased family members in the bedroom. Interesting. And on a more practical level, be consistent with your bedtime, especially people that are Vata and Kapha. They tend to not care, or they get lost in whatever they're doing. So consistency with bedtime is really important. And looking at the quality of light. Okay. If there's too much LED light in the room, it's been shown to be a problem. And so it's creating a softer, welcoming space. The bedroom should just be for two things: sleep and being intimate. That's it.
Those are really helpful tips. And as you were listening to them, I'm thinking about my bedroom, like, oh yeah, okay, do I need to check under the bed and make sure there's not too much clutter under there? Or I love to read, so there's not too many books around there. So I'm going to do a little inventory of my bedroom. But yeah, those are great tips. And very interesting about the headboard, which direction it should be facing. When I did some Ayurvedic coursework, I learned that as well. And even through my own personal journey with yoga and meditation, that's one thing that they've recommended. So I'll see if I can dig up some studies on that as well. If anyone wants to nerd out on it, I can post those down below. You mentioned the Abhyanga, the oil massage practice for evening for people who have anxiety and insomnia. Are there any other practices like that that you might recommend for those who have maybe racing thoughts or anxiety at night?
There's one intervention we haven't talked about that I think could be of value. It's Nasya oil, of all things. Okay. Nasya oil basically can be your basic sesame oil. It can be olive oil if you don't have that. And Nasya is just in reference to the fact that you're inhaling it and you can get a container that has oil and a dropper, and where you can either put it in your hand and either use a Q-tip or your finger, or you can actually drop it up into the nose, and you actually want to inhale it. And doing that in the morning actually can be very stimulating to the brain, but at night, it does two things, three actually, at least. You get rid of debris that you gathered through the pollen, the pollution, whatever, but it also helps to reset the nasal passages so that there's better airflow, and it can allow for less obstructive breathing as a result, especially during allergy season. And that helps then. But most importantly, it ultimately calms the brain too. Okay, so it stimulates a little bit, but it also calms the brain overall. And you can get where they have some herbs like Brahmi, which is very good at supporting the brain. And then there's some that also has, for example, eucalyptus, which helps to, again, cleanse, but also stimulates the brain. So you can manage with Nasya oil your allergies for sure, and your nasal health, right? But because the interesting thing is, it is the one cranial nerve that goes straight up into the brain from the nose, and it's like a direct connection. So you're actually impacting the brain very quickly with the Nasya oil.
What sort of oil do you recommend?
So there's a couple that Banyan carries. And the other thing is the quality of their oil is good and it's typically organic. And so anytime, that's a very good question. So if somebody wants to not purchase the oil and do it at home, think about any product that you either put in your mouth or on your skin or up your nose, that it be food grade quality and organic, because each of those parts of our body absorbs it right into our being, and it can create all kinds of health issues if it's not as pure as it can be.
Super helpful. All right. You have a freebie for our audience.
Yes, the freebie has to do with exploring and sharing some of the topics that we've talked about in terms of the evening routine. But I will include some of the morning routine in that so that they understand that it's upon arising that you help prepare for what needs to happen into the evening too.
Excellent. I think that's going to be so helpful. So I'll put the link to that in the video descriptions. You can go ahead and grab that freebie to learn more about Dr. Pentz's recommendations for the morning and evening routine. And Dr. Pentz, where can people learn more about you if they want to follow you or if they want to work with you?
So I have a website, that's drpentz.com, and my email is office@drpentz.com, and that's drpentz.com. And then if it's possible, if I just wanted to mention a couple things about the panchakarma therapy, because the one thing that I mentioned at the beginning that I thought was important, you can do everything I've just mentioned without ever doing panchakarma. But this is an amazing general detoxification of the mind and the body and the spirit. And during this time, there's a reduction of stimulation of senses, no alcohol, no drugs, no sex. The daily body routines that you are going through and the detox that happens with herbal concoctions that help both nourish but also release all the stuff that gets built up in the bowel during this time is really but also an intense time in certain ways, because there's no external stimulation allowed. And you really are working on reducing the senses. And there's pranayama or breath work that's part of the program that you do twice a day. Usually there's a yoga class that happens in the morning, if not twice a day. And bedtime tends to be about 9 o'clock because people tend to be so exhausted from the whole experience of releasing and detoxing. And it ends up being a complete reset for the mind, body, and spirit. And oftentimes insomnia actually is cured during that time. And I just wanted to mention that.